Thank you for watching Dr. Bats Explains. Today we are going to go through the anatomy of the breast, starting from its embryological development. We go to appearance of the breast at different stages, starting from infants to adults, and the common disorders, the common signs or defects in breast appearance. We are going to talk about the surface anatomy of the breast. We're going to talk about the internal structures, underlying structures, the blood supply, the innervation of the breast, and the lymphatic drainage. We're also going to talk about the diseases, common diseases that affect the breasts, and the common signs and symptoms, or maybe the common treatments associated with them. Thank you.
In the young embryo, a linear thickening of ectoderm appears, called the milk ridge, and this milk ridge extends from the axilla to the inguinal region, what we call the grain. In animals, several mammary glands are formed along this ridge, but in the human, the ridge will disappear except for some small part in the pectoral region, and if this ridge fails to disappear in some regions, some people develop what we call congenital anomalies, for example, polyphilia. In polyphilia, you find someone with multiple nipples. If it's not a polyphilia, you can have polymastia. You find people with accessory breasts. You find someone with an accessory breast in their armpit or in their axilla, or even below. This ridge can also be called the milk line of skulls. So after it has disappeared, it disappears except for some part in the pectoral region around the chest, and that is where we develop the mammary glands. This localized area in this pectoral region will start thickening and become slightly depressed. So this milk ridge is made of ectodermal cells, but when the mammary glands are developing, they start growing downwards, what you call a downgrowth of this ectodermal line into the mesenchyme, or downwards. So it sends off 15 to 20 solid cords which grow into the underlying mesenchyme. Meanwhile, the underlying mesenchyme also proliferates and the depressed ectodermal thickening becomes raised to form the nipple. So this one happens in later stages during the development of the breast. So in cases with people with an anomaly, for example, some women have an inverted nipple, or what we call a retracted nipple. It happens during this development where that it will not raise or to come out to form a nipple. At the 5th month, the areola is recognized, meaning 5th month of gestation, and it is recognized as circular pigmented area of a skin around the future nipple. Breast development starts at week 7. So from that mammary ridge, say that the primary buds develop downwards. They will form secondary buds, they start branching till they form lactiferous ducts. So by the time of birth, at the position of the breast, we simply have a papilla elevation, which opens into a mammary pit, or we call an epithelial pit, coming from lactiferous ducts meeting at this point. So the breast is still rudimentary. Among men, it will not develop much. It ends at a certain point around 10 years. And beyond that, when you reach puberty, then other changes set in. At less than 10 years, breasts simply have papillary elevations only. So it is not easy to distinguish the difference between that of a boy and that of a girl. These papillary elevations will develop into buds. So they developed into palpable buds which can be felt or palpated. And the areola, the pigmented area, also starts enlarging. So that is between 9 to 13 years. From 12 to 14 years, the breasts, they start showing elevation of contours. So that is when the appearance, the contours start becoming more pronounced. From 12 to 14 years, also the areola continues to enlarge. From 12 to 15 years, the breasts form secondary areolar mounds. So it becomes more, if it is for girls and adolescents, becomes more attractive. Then it will continue to develop to a mature or to an adult breast between 14 to 18 years, that is during the teenage years. This, the breasts show an adult breast contour. Then the areola recesses to general contour of the breast and the nipples project outwards. So during 14 to 18 years, that is when the nipple will become more pronounced. So those are the simple changes that take place after birth. Also, all these changes, they are taking place due to changes in the internal anatomy. So when you're looking at primary buds forming, that means that the mammary glands, that what were simply ducts, now they are starting to develop into lobules. So all this is in preparation that by the end of adolescence or puberty, the woman is ready for pregnancy, is ready for breastfeeding. So the lobules have to develop from the lobes, the development of alveoli, which becomes more pronounced in pregnancy, of course, as we are going to talk about it. So those stages of changes in appearance and structure of the breast after birth, especially in girls, what you call the Turner stages of breast development, they help in diagnosis to find out whether the development of the breast is normal or abnormal. For example, in some girls, by the time a girl is 14 years, expect that at least the contours have started what? Developing. Meaning at that point, if the girl is still remaining with what? With papilla or simply a what? Mammary bud, a simple bud, it can be a sign that there is probably a problem with their body physiology. It might be due to hormonal imbalances. So we have cases where we have micromastia, where the breast remains very small compared to the normal. Micro meaning small. It can also be macromastia, where in some girls they become exceedingly large, more than normal, and this is mainly attributed to hormonal. So it mainly happens during puberty. So macromastia may not be a disease. It's not showing a disease, it is simply an abnormality which is coming due to hormonal imbalances, and such a person is normal. Same with micromastia. It may not be specifically a disease or a heritable, an inheritable disorder. So also during puberty, that is 10, starting from 10 years, okay, upwards up to 18 years. In boys, they can develop what you call gynecomastia, that is enlargement of breasts. Simply enlargement, we to the point that it becomes exceedingly conspicuous. That you look at the breast, that it is coming more of a girl's breast. So it is also a normal condition which comes due to hormonal imbalances. And let's start on the surface anatomy of the breast. Looking at the skin, by the way, the breast is mainly made of fat tissue, glandular tissue, and connective tissue without muscles. So in the appearance, when you start from the nipple is usually at the lower part of the breast. And the nipple, of course, a nipple contains pores, contains small holes that connect to the ducts inside. Meaning during breastfeeding, milk comes through the nipple through these pores. The pores are actually around 9 to 12 pores. Around, yes, it is the areola, and the skin of the areola is usually more pigmented than the rest of the skin. In this areola, you can see these glands, those swellings or tubercles, which are swellings of the areola glands, and they are called Montgomery's tubercles or Montgomery's glands. These glands are a special type of sebaceous glands, meaning they secrete an oil. And that oil, of course, is for lubrication during breastfeeding. This one also has antimicrobial properties, preventing entry of pathogens through the breast. There are some contaminations that can come through the breast. So these tubercles will become many and more bigger during pregnancy, and also the nipple becomes longer during pregnancy in preparation for breastfeeding. This breast, for example, during Paget's disease of the nipple, it mainly affects the nipple around here. Paget's disease can be as a sign of a cancer inside. Inside the breast, the mammary glands are divided into lobes. and we have around 15 to 20 lobes. Also, these lobes, they are further divided into lobules. And also inside the lobules, they are further divided into alveoli. So all this increases surface area, of course. Surface area for lactation, for milk production. There are numerous of ducts coming from these lobes and lobules. They meet and connect and form lactiferous ducts. Before these lactiferous ducts reach the pores of the nipples, they become wider, forming a sinus, which is a temporary store of milk. So we have the lactiferous sinuses, they open up into the nipples. So those are the lactiferous ducts and lobules. They are surrounded with adipose tissue. Between these glands, we have connective tissue in form of suspensory ligaments, also called the ligaments of Cooper. They connect to the fascia below the skin of the breast to the fascia on the pectoral muscle. So these ligaments, they are important in the shape and appearance of the breast. And usually when they are stronger during the young nulliparous females who have not yet given birth. Therefore, they have a more pointed breast. And as aging continues, as the ligaments start weakening, and the breast becomes more pendulous and more pendulous. This is the role of these ligaments. The breast is made of a lot of fat tissue, and a good percentage of it is simply adipose tissue for cushioning and warmth. So usually during breast surgeries, for example, in case of reducing people with macromastia, it might be due to build-up of these fat tissues, not basically the glandular tissue. So it can be cut off and reduced, reducing the size of the breast. Now, on the base of the breast, we have what we call the retromammary space. This space contains loose connective tissue, so the base of the breast is loosely attached to the fascia of the pectoral muscle. And this space can be exploited during breast implants. Some people want to have bigger protruding breasts, so they can get a silicone bag containing a saline fluid, and they place it either in between this retromammary space, causing the breast to become more pointed and firm. Or it can also be put just behind the pectoralis muscle, pumping the breast outside. Understanding the structure of these lobules and how they are arranged, the glandular tissues arranged inside the breast is important in diagnosis. For example, when you have done a mammogram, usually when they are checking for cysts, they are checking for tumors in the breast. Understanding the structure of these lobules helps to know the presence of cysts, presence of abscesses, presence of tumors in the breast. That is, even enables you to interpret a mammogram. During breastfeeding, there are different hormones that interact that control the growth of these ducts. So usually towards pregnancy, the ducts become more developed and more branched, and also the alveoli become more conspicuous inside these lobules, all in preparation for breastfeeding. There are mainly four hormones that participate in lactation. Lactation, we're talking about milk production and letdown, milk secretion and production. During development, during pregnancy, it is mainly the progesterone and estrogen hormones important for development of the breast. The estrogen hormone is mainly important in the growth and maturation of the ducts themselves, the ducts and lobules. Then progesterone is mainly involved in formation of alveoli and lobules. So progesterone and estrogen, they are mainly in breast development. Then when you go to milk production and secretion, we talk of prolactin and oxytocin. Oxytocin primarily is important in ejection, that is let down, and we talk of oxytocin in the milk let down reflex.
That prolactin is mainly in secretion. When prolactin is secreted and reaches these ducts, when it reaches the ducts, it stimulates the lactiferous, it stimulates the cells of the lobules and alveoli to start secreting milk, producing milk from nutrients from blood. This is controlled by the prolactin hormone. But when we talk of oxytocin, we talk about it in the letdown reflex. In the milk letdown reflex, a stimulus from the breast that is due to suckling inhibits the release of PRL inhibiting factor. And when this inhibiting factor is not released, it causes a surge in the PRL, which increases milk production. Also, the stimulation of the nipples during suckling causes a surge of oxytocin. So more oxytocin is released from the hypothalamus, causing expulsion of accumulated milk by stimulating the myoepithelial cells. When they are exposed to oxytocin, they contract, thereby expelling milk out of the breast. That is the milk letdown reflex. The blood supply to the breast is mainly from three arteries: the internal thoracic artery or the internal mammary artery when you're talking of the mammary glands or the breast itself. This internal mammary artery is a branch from the subclavian. We have the lateral thoracic artery. I'm talking about the main drainage. The lateral thoracic artery is a branch from the axillary artery. And we have the intercostal arteries. Intercostal arteries, various branches, cutaneous branches coming from the intercostal arteries. They also supply the breast. Then we also have other drainages. You can have a drainage from the pectoral branch of the thoracoacromial artery. Thoracoacromial artery is also a branch of the axillary artery. So the pectoral branch of this artery also supplies the breast. The branches coming from the internal mammary artery, those that supply directly the breast, there are mainly three: the second, third, and fourth perforating branches. Since these arteries deep down into the thorax, there are branches that perforate out from the muscle and they supply the breast, because the breast is attached superficially on top of the chest muscles, the pectoralis muscles. So these arteries have to perforate and come and supply the breast. So that is the main blood supply of the breast. The thoracoacromial artery, of course, is near the pectoralis minor, followed by the lateral thoracic artery. Lateral thoracic artery supplying the lateral part of the breast. Then the internal mammary artery supplying mainly the medial part of the breast. When we talk about lymphatic drainage, it is very crucial, especially in immune function. The lymphatic vessels that drain the breast, they mainly connect to lymph nodes, and those are mainly the axillary lymph nodes, meaning the lymph nodes in the armpit. We also have the nodes, the parasternal nodes, or you can call them the internal thoracic nodes because they are along that internal thoracic artery. Those are the main nodes that receive drainage from the breast, the lymphatics from the breast. The axillary lymph nodes are divided into five groups depending on their positions. They can have another set of names. They can also be grouped into levels: level 1, level 2, and level 3, moving upwards. When it starts from the pectoral group is the anteriormost group. So when you are looking at the breast on the lateral part, this pectoral group of muscles is behind the pectoralis major, meaning you're not finding them in the breast itself. Behind the pectoralis major, on the lower border of the pectoralis minor, that is where we have this pectoral group. We have the posterior group or the subscapular group. The posterior group it mainly drains from the posterior chest wall, but part of the breast, the lymphatics of the breast, they drain through these posterior lymph nodes. So they can be called posterior lymph nodes or subscapular
lymph nodes. The subscapular lymph nodes and pectoral lymph nodes, they all drain into the central lymph nodes. So the central lymph nodes, they are all along the axillary artery. We have the lateral lymph nodes. Lateral lymph nodes, you're almost heading to the arm. The lateral lymph nodes and the lateral lymph nodes, all these three drain into the central lymph nodes. However, the anterior lymph nodes, these pectoral group of lymph nodes, may also drain directly into the apical lymph nodes. So from the central lymph nodes, the lymph goes through the apical lymph nodes, and from the apical lymph nodes, you have a terminal duct that goes and drains directly into the subclavian vein, taking back the lymph into circulation. This lymphatic system is important in diagnosis, especially in cases of cancer. We talk of the sentinel node biopsy, all done during treatment of cancers, because usually the cancer cells, for example, if the cancer originates from the breast, maybe from the ducts or from the lobules, it can spread through these lymphatic vessels and come and attack these lymph nodes, causing their swelling, inflammation. So usually the lymph nodes affected can tell you, a clinical officer, to know which part of the breast is affected. Mainly since the lateral part of the breast drains into the pectoral group. If we find the pectoral group is having an issue, you're finding swellings of the pectoral group, usually a sign that the lateral part of the breast has issues, or the cancer may be mainly on the lateral side of the breast. If you find the parasternal lymph nodes, these lymph nodes along the internal thoracic artery, when they are having issues, or if you test them when they have been attacked by cancer, they are multiplying, they are swelling, they are developing tumors, it is a main sign that the medial part of the breast is mainly affected by this cancer or by the disease. So this lymphatic system is also important in cancer diagnosis. However, it can also be used to identify during treatment. Sometimes they do mastectomy, that is removing the breast tissue in case of cancer to prevent it from metastasizing or from spreading to other regions. Because cancer can spread from the breast, it can go to the liver, it can attack the brain, it can go deep into the abdomen through this lymphatic system. So knowing this lymphatic system, also you know that if it is the pectoral groups, maybe and the central groups affected by cancer, during mastectomy, also these lymph nodes are cut out and removed along with the breast tissue, preventing it from spreading from one point to another. Sometimes we can have cyclical. When you have cyclical pain in the breast, it may be along with the cycle, maybe once a month. Then the other month it comes back, it goes. It can be due to hormonal influence, usually associated with a menstrual cycle. So it may not be specifically, and if you have breast pains, light swellings, tenderness of the breast, it can also be caused by hormonal influences. But it also a common symptom in many other issues. For example, you can have breast pain due to mastitis in the breast. You can have it due to Paget's disease and other disorders. Mainly, the breast is innervated by intercostal nerves. You have intercostal nerves, the anterior mammary costal nerves, that is on the medial side. On the lateral side, also have branches from the intercostal nerves. On the medial side, we have branches from 3, 4, 5, and 6 intercostal nerves. Then on the lateral side, we have branches from 2, 3, 4, 5, and 6, also all innervating the breast.